there's no movement. So that's going to be a synarthrosis. Then the next one we're going to take a look at, if you look on your notes for a second, number 1 is synarthrosis. You're going to see there's 4 types. Number 2 is what we call an amphiarthrosis. Amphiarthrosis means there's 2 bones that come together, but there's a little bit of movement. So the joint allows for a little bit of movement. I'll do that second. And then you see the third classification there, number 3, diarthroses. Those are joints that have a lot of movement. That's what we typically think of, like your shoulder, your elbow, your wrist, your hip, knee, and all that kind of stuff. So that's what we're going to kind of take a look at. Okay. The words are a little bit ugly, but here's good news. It's not on next week's test. You can worry about them for test number 3. So they are tough, though. They took me a long time to get as a student. I thought they were difficult. So it is what it is. So let's take a look at synarthrosis first. So watch this. We have 4 types of joints that are classified under synarthrosis. That means the joint is formed, but there's no movement. The first one you know already is a suture. Remember we studied the sutures. What was the name of the suture that went down the middle? Sagittal. What was the one that came across? Coronal suture, that type of thing. So those sutures where bones come together, they're immovable. Now, anatomically, if you were to take a suture apart, bear with me 1 minute. Here's a suture. This happens to be the coronal suture, right? If we were to blow it up, you would see the 2 cranial bones with fibrous tissue in between, like a ligament in between. So anatomically, this doesn't have cartilage. It has a ligament holding the bones together, which we really can't see from our skulls, but it's inside the suture. So anatomically, it's a fibrous joint. Functionally, it is a synarthrosis or an immovable joint. Any questions on that? Let me just get my clicker. Okay. Sorry about that, guys. So let's go back a minute. The second type of synarthrosis, again, a weird kind of name. It's called the gomphosis. So when we have, here we go, here's a review for next week, because I'm going to ask you, what are these sockets called in the mandible and the maxilla that hold the teeth? What do we call those? Begins with an A. Not areolar, but alveolar. Very good though, alveolar process. So the socket in the alveolar process that holds the tooth is a gomphosis. A socket with the tooth in it. And if you try to move your teeth, do they move? I mean, they shouldn't, right? They shouldn't move. That's because it is an immovable joint. Here's a picture of a tooth. It's in the socket. This is the alveolar socket, like you said before. And if you notice, the tooth is in there. And I'm not sure if you guys can pick it up in the back. We see these ligaments right here. All these ligaments, we studied these in A&P too, are called periodontal ligaments. They hold the tooth in place. Now, have you ever had a tooth extracted? I know for me it was like a long time ago as a baby, right? Last week, right? Did you hear it? They actually, when they're taking the tooth out, you hear like cracking and stuff like that. They're ripping all those ligaments out so they can extract the tooth because it's an immovable joint. So this is what we call a gomphosis. Suture, gomphosis. Okay? The third type is called a synchondrosis. A synchondrosis. Let me see if I have. Okay. Watch this. This is an immovable joint, but watch this. This is our first one that is cartilaginous. These two were both made of fibrous tissue like ligaments. So anatomically, these were ligaments. This is the first one we're looking at that's an actual cartilage. I'll get the skeleton in a minute, but watch this. Our ribs, when they came up, did they touch the sternum? Did the bone touch the sternum?
At the top, right?
Yep, not quite there. What was in between the rib that ended here? Hyaline cartilage, right? The costal cartilage, the hyaline cartilage. So if you remember, our ribs only say come to here. Now there's a piece of cartilage connecting the rib to the sternum. That is a synchondrosis. It's a cartilaginous joint in which the connecting material, like you said, is hyaline cartilage. So the example of the rib touching the sternum with that piece of cartilage in the middle is a great example. It's a great example. Another example I have you guys done chapter 5 yet or chapter 6 in lecture?
No.
Bone tissue?
No.
Not yet? Okay. You're familiar with the growth plate that we have in bones that allow you to grow during your formative years, right? From the time you're born to the time you stop growing, say at 20, 22 or something like that, you stop growing. We have a growth plate in all of our bones that allows us to grow. If you didn't have that growth plate, you would stay small. So watch this. Here is one bone, right? They took the humerus, and you can see the head of the humerus and the shaft of the humerus, and then there's a piece of cartilage in the middle. That cartilage is there our entire life while we're growing. This is an example of two pieces of bone separated by, again, hyaline cartilage. The growth plate is hyaline cartilage. So we call this a synchondrosis. Again, tough words, right? They all kind of sound the same. But that's the main thing with this. It's the growth plate or a piece of hyaline cartilage connecting two bones. Questions or comments on that? Again, this here is a good example, the costal cartilages or a growth plate, if I were to ask you. So here's what happens. You stop growing, let's say, at the age of 20. Everybody's a little bit different. Some people have been growing until like they're 25, so it's very variable. So let's say the growth plate is there until you're about 20 years old. What happens then is the growth plate turns to bone. So the joint goes from being a cartilaginous union to a bony union, which is kind of weird. For those of you going into X-ray radiology, you'll see the growth plates as a white line. It's a thin line of bone where the growth plate once was. You can actually pick them up on the X-ray. So when a cartilaginous joint is replaced by bone, that's our fourth type of immovable joint called a synostosis. Synostosis. And all that means is a cartilaginous joint turned to bone. How about this one? I'm going to ask you this next week, so this is a good review. Remember the baby had a suture in the frontal bone. Remember in the frontal bone we have two of them when we're born until the age of 6 or so? What's that suture called? Anybody remember? Okay, before that though, it's called he said it's called the metopic. That's if it doesn't close. It's just called the frontal suture. At the age of 6, that suture goes away, it turns to bone. That would be an example of also a synostosis. You are 100% correct. If it doesn't fuse, then we call it a metopic. Very good. Right, very good. Okay? Anybody, questions or comments? Like I said, the words are tough. They're going to take a little bit of getting used to. It took me a long time, when I was in your position, to get them down. They all sounded the same. They were very confusing. So that's going to take a little bit of work. But like I said, that'll be on your third exam. We don't have to worry about it right now. Okay, the next classification, watch this, is an amphiarthrosis. So this is number 2, amphiarthrosis. What this means, guys, is two bones come together, but it allows for slight movement, a little bit of movement between the bones, okay? The first one is called a syndesmosis. The best example I can give you is, remember last week we did the tibia and the fibula bones sitting side by side in the leg? There is a ligament between the tib and the fibula right here. It's a fibrous joint, so it means it's got a ligament here. There's a little bit more fibrous tissue than in a suture. So your tibia and your fibula can do this. They can actually kind of glide past one another a little bit. Right? That bump on the outside of the ankle, if you remember from last week, is called the lateral malleolus. Right? That actually can move a little bit like that, back and forth, because this fibrous tissue allows for some movement. It's not like a suture where there's no movement. It allows for a little bit of movement. So this is a good example of a syndesmosis. Right? It's an amphiarthrosis. The second type of amphiarthrosis, there's only two. compared to 4, what we saw on the other one, is called a symphysis. So if you remember last week, one of the structures I had you know was between the 2 pubic bones, there was a little disc of cartilage called the pubic symphysis. We actually use that word right here. This is a good example, the pubic symphysis. Actually, any disc in the body is classified as a symphysis. All the discs between the vertebrae back in here, each one of those would be a symphysis or the pubic symphysis. So if I were to ask you on the third exam, you know, what would be an example of a symphysis, I would actually answer pubic symphysis because it has the name in it. It makes it real easy. But you could also say any disc, right? Allows for a little bit of movement. So this is probably the easiest one to remember. Okay. So 2 joints or 2 types of amphiarthrosis. Right? Amphiarthrosis meaning slightly movable, just a little bit of movement. Anybody, questions or comments? Okay. These are the joints you tend to think about most of the time. These are our freely movable joints. We classify these as diarthroses. And so all of your freely movable joints, the ones that you really can see moving and things like that, your fingers, your toes, your wrists, shoulders, all this stuff here, these are freely movable joints. Some people, myself included, sometimes call them synovial joints. What that means is there's a little bit of a lining inside the joint that makes a fluid. Have you guys ever heard of synovial fluid? You ever heard that term? In chapter 4, in lecture, you guys may not even be there yet then, they talk about different membranes. There's a synovial membrane inside a joint, and it makes this fluid that bathes the joint on the inside. So all of our freely movable joints have fluid inside of it, okay? So that's why they call them synovial joints. Right? It contains a fluid-filled cavity between the joint surfaces. Okay? So there's always fluid inside there. So what I wanted to do is just show you, what does a synovial joint look like? These are some common things. So watch this. There's a picture. This is actually out of your book. Let's pretend this is the joint right here between your proximal phalange and your middle phalange. So there's a joint right there. So this would be the proximal phalange. Here's the middle phalange. Notice the 2 bones don't touch. There's a space there, right? And that's what we call the cavity, joint cavity over here. And then inside this cavity is that fluid we were talking about. Also notice on the bones, there's a thin layer of hyaline cartilage. So right, this blue stuff here is hyaline cartilage, and then this blue stuff here is hyaline cartilage. That's the cartilage at the ends of the bones. If you were to take a chicken bone tonight, say you make fried chicken or something like that, right? And you break the chicken leg, at the ends of the bones would be that shiny, bluish, rubbery stuff. We have that too at the ends of all our bones. That's this stuff over here. So that's hyaline cartilage, right? So a joint space with fluid, hyaline cartilage, your book calls it articular cartilage, it's just the articular cartilage. Then around the joint, to keep all the fluid in, there's a capsule. It goes like this and it goes around like this. So every joint that's a synovial joint has a capsule around it that keeps all the fluid and stuff inside the joint. So this gray thing right here, guys, or kind of bluish gray, I guess, right here, this is the capsule. If you were to do dissection and you would take some tweezers, some forceps, and you were to pull on it, it's like a tough bag. It's really it's a pretty strong thing. It's all fibrous tissue. So here's the deal. Inside that fibrous capsule, this little red line right here, this pinkish red line by my finger going up, that red line is important. That is called the synovial membrane. That's the membrane that produces the fluid for us. Actually, for me even, do you remember, does cartilage have a good blood supply or a poor blood supply? Poor blood supply, right? They don't have, it's actually avascular. So that's a living tissue. It needs oxygen, it needs glucose, it needs to get rid of waste. So how does it get, if it doesn't have a blood supply, how does it get its nourishment? It's from this fluid. This fluid actually bathes the cartilage and keeps it healthy, okay? And this is the cartilage too. Again, we all get a little bit, as we get older, It pretty much affects everybody. This is the cartilage that will wear away when people have like osteoarthritis. You know, people have like wear and tear arthritis. Jack, you were saying, right? You got a little bit of osteoarthritis. Yeah, he has some. You might be talking about just. He has some meniscus, some cartilage degeneration in there. So what happens is, since his cartilage is degenerating in the knee, this hyaline cartilage also starts to wear away and becomes very irregular. And we all get it sooner or later as we get older. It's something you really can't avoid. But that's the articular cartilage that you're starting to lose. You know, as we get older, or trauma. You could be young and healthy. I've seen X-rays where you have people 18 years old with arthritis in the neck, secondary to trauma. Wrestlers, you know, they'll get, you know, football players. They get these little whiplashes and things that happen. So now the trauma actually starts arthritis early on. So it's just one of those things. It's just a fact of life that kind of stinks a little bit. Okay. So those are the parts of the diarthrosis I want you to know. Articular cartilage, joint space with the fluid, a joint capsule, and the synovial membrane lining the inside. Okay, that's common to all of our freely movable joints. Anybody, questions or comments? Beautiful. Okay. So before I show you the specific joints, I have a couple definitions I want to go over for a second. When a freely movable joint allows movement in just one plane, we say that joint allows monaxial movement. So try this for a second. Take your distal interphalangeal joint over here. I have to cheat and hold the lower bone in place. But try to bend it. You can bend it forward, right? Can everybody do that? You can bend it forward. Can you bend that joint side to side? Right, I'm trying right now. I can't move it side to side. Can you rotate it? Right, you can't do any of that. All you can do is bend it forward, straighten it. Bend it forward, straighten it. Since it only allows movement in one plane, this happens to be the sagittal plane. Remember, sagittal goes this way to cut us left and right, so it's in that direction. This would be an example of a joint that is monaxial. It only allows movement in one plane. It kind of reminds me of a door. If I went to this door over here, what can I do with the door? I can open the door, I can close the door, right? It only allows me to do one direction. I can't move the door side to side. I can't move the door like back and forth this way. All I can do is open the door, close the door. This would be an example of monaxial. It allows movement in one plane. Does that make sense? Okay. Biaxial. What does bi mean? Two, right? So this one's going to allow movement in two. Let's do an example like this. Try this. If you were standing in the anatomical position, your wrist, I can move forward and backward. That would be the sagittal plane, right? Sagittal plane goes this way. So I can move it forward and backward. You guys get the attendance in the back? So we can move it forward and backward. This would be the sagittal plane. But can I move my wrist side to side? Yep, we can move it side to side. So that would be in the coronal plane. Remember, coronal runs this way. So a joint that allows two planes of movement, in this case sagittal and then coronal, is called biaxial. What's tri mean? Three. So this one's going to allow three. Let's do an example of this one would be the shoulder. My shoulder, can I move forward and backward? Yep. So this will be sagittal plane. Can I move in the coronal plane this way? Absolutely, right? I can bring it up and down that way. But watch this. I can also move in the transverse plane this way, where I rotate the shoulder this way, kind of along this axis. So the shoulder is an example of a triaxial joint. Triaxial. I want to see how to spell transverse well. You got the E. Okay. The next one's a little bit weird. Sometimes when a joint has flat surfaces, like our carpal bones, our tarsal bones, this is what happens. The two flat surfaces come together like this, but it doesn't move in any particular plane. We can do maybe this. We can move the joint up and down, I can move the joint side to side this way a little bit, but then I can do things like in between. I can just kind of like do any angle in between depending on what stress I put on the bones. So since it's not moving in any specific plane, and it allows movement in a variety of directions, they call this non-axial. It's not moving in any particular way. It just can move in any direction depending on what forces we put on the bones. And we'll see in a little while, our wrist bones are great examples of that. Our foot bones are great examples of that also. Okay? So these are terms I'm going to use when I show you the types of diarthroses. Again, we're still talking about freely movable joints. We're good? So watch this, guys. There are 6 categories, I guess, of diarthroses where the shape of the joint will determine what kind of movement. This is actually a good example of how anatomy dictates physiology. What's anatomy? The study of chapter 1. Structure, right? The study of structure. Physiology is the study of function, right? So here, the anatomy of the joint will determine what kind of movements we can make. Like this joint over here, the anatomy of this joint only allows me to go this way. I can't go side to side. I can't twist it, even though I'm trying right now. None of us can do it, because the anatomy allows for only this function, this movement. So this is a good way to see how anatomy dictates function. So watch this. First one, nice and easy. Ball and socket joint, like the shoulder. Here, the ball of one bone fits into the socket of another bone. And you'll see this allows movement. If you want to just add, guys, to the notes, this is triaxial. A ball and socket joint is triaxial. So again, just to make sure everybody's comfortable with that, if I said I can move the shoulder joint forward and backwards, this would be in what plane? Running this way? Sagittal, good. I can move the shoulder this way, which is what plane? Coronal. And then I can rotate it like this, would be transverse, okay? So the hip joint, the shoulder joint, those are ball and socket joints. Nice, easy one. This is a picture from another book that I used to use. I got to update it to your book. You guys have similar pictures. So watch this. Here's the hip socket. Next week I'm going to ask you, what's the name of that cup that holds the head of the femur? Begins with an A. Acetabulum. Right? So again, these are things you've got to review today while you're here. That cup is called the acetabulum. What's the cup called in the shoulder? That little shallow depression. Glenoid fossa, right? So those are things I guarantee I'm going to ask you next week. So that would be an example of a ball and socket. Okay. The second one is a hinge joint. Think about a hinge on a door. Right? We have this hinge right here. It allows me to open and close. So a hinge joint allows movement in one plane. So what's the term I would use there? Biaxial, triaxial. What was it? Monaxial, good. So if you want to just add, I got to update my notes. Here we want to add that. We want to say it's monoaxial or monaxial, good. What's an example? Here, the joint I was talking about before. This is called the dip, the distal, I put in your notes, dip. Distal interphalangeal joint, that's that guy. This one here, proximal interphalangeal joint. If you just try it, all you can do with those joints is move in the sagittal plane. You can open the door, close the door. That's all you can do. You can't do anything else with those two joints. The elbow, same thing, right? I can close the door, I can open the door. I got a hinge on it. Close the door, open the door. I can only move in one plane.
Can't you rotate the elbow?
That's actually, this pronation, supination, that's actually below the elbow. That's a movement below the elbow. We'll talk about that in a little bit though. Very good. The actual elbow joint itself though, where the trochlea and the trochlear notch meets, won't do this motion here. Good though. The knee, same thing. And then the ankle, right, where the foot kind of goes back and forth like this, where you can bring the toes up or the toes down. That type of movement would be all hinge joints. So those are all monaxial. Ball and socket, triaxial, hinge joint, mon. Just to show you real quick, here's a hinge joint over here, guys. So here's the trochlea. This thing was the capitulum, if you remember from last week. Here's the trochlear notch. So once that trochlear notch goes on the trochlea, all it allows for is this motion here. Okay. The third one is called the gliding joint. So here, highlight this especially. Gliding joints, the surfaces of the bone are flat. Right? So the surfaces of the bone are flat. So again, when you have two flat surfaces go together like this, we'll see that the movements can be in any direction. So what was that fourth one called where we can move in any direction? Non-axial, good, non-axial. Some examples of this, guys, carpal bones. Eight carpal bones we had, right? The 7 tarsal bones. If you look at them today when we bring the boxes out, they're all flat surfaces, right? Those are all good examples. Where the rib meets the vertebrae on the costal facet on the side of the thoracic vertebrae, that's also a gliding joint. And then here, where the clavicle comes up to meet the acromion process, if you were to look at that when the bones come out, you'll see those are two flat surfaces and those two bones glide on one another. That would be another example. We call that joint the acromioclavicular joint. Right? Acromioclavicular joint. Those are all examples of flat surfaces. Let's see what I have over here. Here's an example. So here's the foot. You can see all these surfaces here are flat, basically. All this is all flat. So these bones are just kind of gliding on one another. That's why they call them gliding joints. And again, they move in any direction depending on what weight or force you put on your foot or on your carpal bones. And so those are non-axial. Non-axial. Number 4 is probably the toughest one to kind of picture for a second. We call it an ellipsoidal joint or ellipsoid. First of all, let me tell you this. Picture an oval for a minute, like just an oval. Take that oval and elongate it. Right, so you're going to just kind of stretch out an oval a little bit. That's what an ellipsoidal shape would look like. Okay. So here's a great example. Last week when we looked at so just as a review, the 2 bones in the forearm. What was the name of the bone on the thumb side? Radius. Good. And then the other one on the pinky side just was an ulnar. If we were to pop the hand off, if we actually took the hand off and you looked into the radius, right, on end like this, you would see an oval that's elongated and it's a little bit concave. So it looks something like this up over here. See the radius? It's concave, and then if we looked at it on end, it would be an oval that's a little bit elongated. So that's the ellipsoidal shape. Then the scaphoid and the lunate, they're kind of convex. They fit right into that concavity of the radius. Right? So the hand fits right in there. And we'll see that ellipsoidal joints are biaxial. So we said before, our wrist could do this. We can move in the sagittal plane this way, and then we could do side to side also, right? So you can see the biaxial joint, the ellipsoidal joint allows for 2 planes of movement. All right, so the example would be right here, the radiocarpal joint. If you just want to put in parentheses, that would be the wrist joint that I just showed you. Here's another one too. If we were to look at the metacarpal here, meeting the first phalange, that makes our big knuckles. All these metacarpals make these big knuckles here with our phalanges. Each one of these, if you took your finger, your pointer finger, right, you can go flexion, you can go in the sagittal plane. Can you go side to side? Yep, you can go side to side this way too. So these are all biaxial. These are all ellipsoidal. They actually look ellipsoidal. All right, and then the other example I have up over here, if you look at the top of the atlas on the lateral mass, there's a big oval that's been elongated and it's concave, and then the occipital condyle comes down and it sits right inside there. That would be another example of ellipsoid. Right, my favorite one is, because it's just easy to see, is the wrist. Yeah, I like that one the best. That's a hard one. Last 2, guys. The 5th one is called the saddle joint. So watch this for a minute. There's only one in the body. The saddle shape of one bone interlocks with the saddle shape of another bone. So you have like two saddles, like you would put on a horse. Right? The saddle shape of one bone interlocks with the saddle shape of another bone. The only one we have is in the thumb, where the first metacarpal meets the carpal bone, the trapezium. Watch this. Here it is. So here's the first metacarpal of the thumb. You can see it's got like a saddle shape to it. You got to use your imagination a little bit. And then this one we really can't see has a saddle shape down. So the two saddles interlock like this. And again, where the trapezium meets the first metacarpal, that is the only saddle joint that I know of in the body. Okay? So you tell me, can we move our thumb in the anatomical position front and back? Yep, we can go forward. So that's sagittal plane. Can we go side to side? Side to side, like hitchhiking, right? We can do that. So it is saddle joint, if you can just add for me, is biaxial. I don't have that there. A saddle joint is biaxial. Okay, the last one, I'll just show you over here, is called the pivot joint. We're going to see that pivot joints allow for rotation. So here again, I'm going to ask you this next week, so it's a good review. The ring of the atlas, right? Remember we said the atlas was a ring, C1 is a ring, is going to sit on C2. What is that post that sticks up on C2 that allows for rotation? What's that post called? It sticks off the top of the body of C2. It's unique to C2. Say it loud. Very good, thank you. The dens, awesome, or the odontoid process. That dens is a post that sticks up. Then the ring of the atlas sits on it like that. Now we can turn our head, remember we said in the direction of no, okay? So that would be an example of a pivot joint. Who said rotation before of the elbow? So just to show you, this is the other book here. The head of the radius sits up against the ulna. There is a ligament, I did not teach you this, you don't have to know it, called the annular ligament. It goes around the head of the radius. So if you notice, it's below the elbow joint, but we can now do this, where the radius pivots around the ulna to cause this motion here. Okay, so that's what they have up over here. This is an example of a pivot joint. Since pivot joints only allow rotation, they are considered monaxial. So if you want to just add that, guys, I don't have that in the note there. Pivot joints only allow for rotation. They're going to be considered monaxial. One plane.
Non-axial? Non-axial? Or mono?
Mon, M-O-N. Monaxial. Okay?
Are ellipsoids triaxial or?
Bi. Ellipsoidal is bi. So, like I said, that's the end of the classification. That's tough. It's really hard to learn. Like I said, even when I was in your position, I remember studying them, and I said, oh, the words sound the same, and I would just try to get them straight. You got to look at them and write them over and over again, because I will ask you on the third exam. So hopefully by then you'll have them down. Okay, last couple things I want to go over, and I'll let you guys review. What page are we on?
2.
Okay, page 2. Thank you. So I want to show you real quick. Movements of the body parts. When our muscles contract, and that's what we're kind of leading towards now, we're starting to study the muscles. When our muscles contract, they cause movements. Every time we're all moving here, it's because of muscle contracts. So I want to give you the technical terms for these movements. Let me just slide. So the first two guys are opposites, flexion and extension. Flexion and extension. Watch this. If we're in the anatomical position and I decrease an angle of a joint, so let's just say here's my elbow, and I'm going to make this joint smaller, like by doing this. Notice I'm making the angle smaller. That is known as flexion. Most of the time, we're bringing the body part forward. So my forearm, if you notice, is going forward when I flex the elbow. Right? If I flex my wrist, or you flex your wrist, right? You're going to bring the wrist forward like this. If I flex, you show me, flex your neck. What would that be? Bring the head forward, right? You're making this angle less. Flex your hip would be like this. Again, I'm bringing the thigh forward. The only exception is the knee. When I make my angle of my knee smaller, which way is my leg going? It's going backwards. The knee is the only one that goes the wrong direction. It's just the anatomy of our joint, okay? So flexion is movement of a body part forward, except for the knee, where we're making the angle of the joint less. Guess what extension is? The exact opposite. Here we're moving of a body part backward, and we're gonna increase the angle of the joint. So if I had my elbow flexed, what would extension look like? We're gonna bring the elbow straight. Okay, what would extension of your shoulder be? You're gonna bring the shoulder back, right? Flexion was forward, extension is back. Let's say you go bowling, right? People bowl nowadays, I don't know if they bowl anymore, right? They take the bowling ball, they bring their shoulder back. We extend the shoulder, now we extend the elbow, and maybe even extend the wrist. Go backwards. Then we come forward like this, right? We're flexing at that point. So, extension is bringing the body part back. Extend your neck for a second. What are you gonna do? You're gonna go backwards. Right? Again, what's the exception? The knee. We're gonna move that body part forward. If I have a knee that's flexed, how are we gonna extend the knee? We're gonna straighten it out. So in the anatomical position, the knee is extended. Or the elbows too, actually. Knees and elbows are actually straight. They're extended. Any questions on flexion or extension? Again, it's a term I'm going to use the rest of the semester. Abduction and adduction. So watch this. In the anatomical position, if we take a body part away from the midline, so if I go like this would be abduction of the shoulder. I'm bringing the body part away. Right? Abduction of the hip. I would bring the hip out like this. Adduction is bringing it back to the body. You're going to add it back to the midline. So we're going to come back this way. This would be adduction. You show me. Go in the anatomical position. Show me abduction of your wrist. What would that look like? Which way are you going to bring your wrist? Out. Yep, exactly like that. And then adduction of your wrist is in like that. Okay? Abduction, adduction. And the reason I say AB, a student asked me the other day, I didn't even realize I knew it. If you say abduction, adduction, they sound the same, so sometimes you don't know what you're talking about, what somebody's talking about. So I usually just say abduction so that it's clear when you hear it from adduction. That's the only reason I do it. I didn't even realize I do it anymore, but a student asked me, like, why don't you just say abduction? Right? And the reason I don't do it is it sounds the same to me, abduction, adduction. Become an old guy like me, everything sounds the same. You can't hear nothing, so you got to distinguish it. Okay. Show me abduction of your fingers in the anatomical position. What would you do with your fingers? Abduction. You're going to take your fingers, not your wrist. Fingers. You're going to go like this. Yep. Perfect. Adduction of your fingers is back. Abduction away. Adduction back. Okay. Any questions on those? Now the next two, a lot of teachers don't teach. I'm going to throw it in there. Watch this. They're both an abduction and an adduction also. So the definition is the same as far as moving away and back together. But here's the difference. We don't start this one in the anatomical position. We start this one in this position. So if I were to go like this, I'm 90 degrees like this. Now I bring my arms away. This would be horizontal abduction. So like say doing a breaststroke, say you're swimming and you, instead of swimming like what do they call that, the crawl, hand over hand, but you do this, that would be horizontal abduction. Let's say you go to the gym today and you want to work your chest out, right? You're going to come, exactly, you're going to come like this, horizontal what? Adduction, horizontal adduction. Our pec muscles do horizontal adduction. Okay, so what's the difference, guys, between the previous slide and these? The first two is anatomical position. This one we're starting perpendicular, 90 degrees. Okay, does that make sense?
Yeah.
Awesome. The next two are rotation of a limb. So watch this. If I took the humerus, we said the humerus was a ball and socket joint, triaxial. If I take the humerus bone and I rotate it out, like that, that is lateral rotation. Or some people call it external. When I was in school, I learned it as external. It wasn't until I came here that I heard lateral, just another way of saying it. But they both make sense. What's it going to be if I turn the arm in now? Internal or medial rotation. So whatever you're comfortable with, they're both correct answers. You could say internal or medial, or you could say external or lateral. I think they're both good descriptions. Okay, your hip joint, same thing. Medial rotation, lateral rotation. You're just turning the femur in or out. So those two are opposites also, right? Circumduction, watch this. Biaxial and triaxial joints that can do flexion and extension, abduction and adduction like that. Watch this. We can do this where we actually combine the movements to get this kind of a circular motion. This is called circumduction. Circumduction. This is where we can do flexion and extension, abduction and adduction in succession like this. Any biaxial joint, if you just want to add guys to this, just to kind of keep your, so you know which joints can do it. Any biaxial joint, any triaxial joint can do it. Shoulder joint, right? You can do in a circle. Your wrist joint. Remember we said your big knuckles here are a biaxial, right? You can go like this. Remember you get 100 on my next test. You can go, woohoo. You get 100. You can do it with biaxial. That's circumduction. Okay, circumduction. The next two, this is actually what you were talking about before, are movements of the forearm. So watch this. If I took my forearm and I have my palm up, this is supination. If I take the palm and I face it down or backwards, pronation. Okay, so think supination, like holding a cup of soup. Or the very first day, what was it called when we were laying on our back? First definition, supine. Laying on your stomach was prone. So you can remember that way too. Supination is face up. Pronation, face down, however you want to remember it, okay? But those are movements of the forearm. When we look at the palm, if the palm is forward in the anatomical position, we are supinated. If the palm is backwards, pronated, right? So we have the arm bent, supinated, pronated.